Ultimate Mental Health Psychopharmacology Practice Guide. Question 1. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as Option A, moderate, Option B, severe, Option C, mild, Option D, non-existent. The correct answer is Option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 2. In treating a patient with generalized anxiety disorder, GAD, using cognitive behavioral therapy, CBT, what is the most appropriate goal of this therapy? Option A. To explore the patient's childhood experiences. Option B. To reduce the patient's symptoms through medication. Option C. To change the patient's negative thought patterns. Option D. To improve the patient's social skills. The correct answer is Option C. To change the patient's negative thought patterns. The most appropriate goal of cognitive behavioral therapy CBT in treating generalized anxiety disorder GAD is to change the patient's negative thought patterns. This therapy focuses on identifying and modifying. Question 3. Which of the following therapies is considered the most effective for treating phobias? Option A, cognitive behavioral therapy. Option B, psychoanalysis. Option C, medication management. Option D, group therapy. The correct answer is Option A, cognitive behavioral therapy. Cognitive behavioral therapy CBT is widely recognized as the most effective treatment for phobias. CBT helps individuals identify and change negative thought patterns and behaviors associated with their phobias. Question 4. Luke's family comes home one evening to find him extremely agitated, and they suspect he is in a full manic episode. The family calls emergency medical services. While one medic is talking with Luke and his family, the other medic is counting something on his desk. What is the medic most likely counting? Option A, hypodermic needles. Option B, fast food wrappers. Option C, empty soda cans. Option D, energy drink containers. The correct answer is Option D, energy drink containers. During a manic episode, individuals often exhibit symptoms such as hyperactivity, decreased need for sleep, and excessive involvement in activities that can have harmful consequences, such as overconsumption of. Question 5. When should healthcare professionals be most alert to the possibility of communication errors resulting in harm to the patient? Option A, change of shift reports. Option B, admission interviews. Option C, one-to-one conversations with patients. Option D, conversations with patient families. The correct answer is Option A, change of shift reports. Healthcare professionals should be most alert to the possibility of communication errors resulting in harm to the patient during change of shift reports. This is a critical time when information is transferred. Question 6. A client has been taking lithium for several years with good symptom control. The client presents in the emergency department with blurred vision, tinnitus, and severe diarrhea. Which lithium level should the nurse correlate with these symptoms? Option A, 3.7. Option B, 1.7. Option C, 2.6. Option D, 1.3. The correct answer is Option B, 1.7. Symptoms such as blurred vision, tinnitus, and severe diarrhea are indicative of lithium toxicity. A lithium level of 1.7 is within the toxic range. When clients present with these symptoms, it is crucial for the. Question 7. A patient diagnosed with bipolar disorder is experiencing a depressive episode. Which medication is commonly prescribed for this phase of the disorder? Option A, valproic acid. Option B, risperidone. Option C, fluoxetine. Option D, lithium. The correct answer is Option C, fluoxetine. The correct answer is C, fluoxetine. Fluoxetine, a selective serotonin reuptake inhibitor (SSRI), is commonly prescribed to manage the depressive episodes in bipolar disorder. SSRIs are effective in treating the. Question 8. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of. Option A, the need to dominate others. Option B, inventing traumatic events. Option C, a need to develop close relationships. Option D, a potential symptom of traumatization. The correct answer is Option D, a potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 9. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist, can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting. Question 10. Pablo is a homeless adult who has no family connection. Pablo passed out on the street, and emergency medical services took him to the hospital where he expresses a wish to die. The physician recognizes evidence of substance use problems and mental health issues and recommends inpatient treatment for Pablo. What is the rationale for this treatment choice? Select one that doesn't apply. Option A. Intermittent supervision is available in inpatient settings. Option B. He requires stabilization of multiple symptoms. Option C. How do you feel about talking to a mental health counselor? Option D. Medication adherence will be mandated. The correct answer is option D. Medication adherence will be mandated. The correct answer is D because medication adherence being mandated is not a primary rationale for inpatient treatment. The main reasons for recommending inpatient treatment in this scenario include the need for. Question 11. Which approach involves surgically implanting electrodes into specific areas of the brain to stimulate regions identified as underactive in depression? Option A. Transcranial magnetic stimulation. Option B. Deep brain stimulation. Option C. Vagus nerve stimulation. Option D. Electroconvulsive therapy. The correct answer is option B. Deep brain stimulation. Deep brain stimulation is a treatment approach that involves the surgical implantation of electrodes into specific areas of the brain to stimulate regions identified as underactive in depression. This method aims to. Question 12. Which chronic medical condition commonly triggers major depressive disorder? Option A. Pain. Option B. Hypertension. Option C. Hypothyroidism. Option D. Crohn's disease. The correct answer is option A. Pain. Chronic medical conditions can significantly impact mental health, often serving as triggers for major depressive disorder (MDD). The correct answer is a pain, as chronic pain is one of the most well-documented. Question 13. What is the most appropriate intervention for a patient experiencing a panic attack? Option A. Encourage deep, slow breathing. Option B. Encourage the patient to talk about their feelings. Option C. Leave the patient alone to calm down. Option D. Engage the patient in a physical activity. The correct answer is option A. Encourage deep, slow breathing. Encouraging deep, slow breathing is the most appropriate intervention for a patient experiencing a panic attack. This technique can help the patient regulate their breathing, reduce hyperventilation, and promote. Question 14. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A. Providing information about effective nursing techniques. Option B. Identifying risk factors that contribute to the development of a disorder. Option C. Identifying individuals in the general population who will develop a specific disorder. Option D. Identifying which individuals will respond favorably to a specific treatment. The correct answer is option B. Identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 15. Ted, a former executive, is now unemployed due to manic episodes at work. He was diagnosed with bipolar I 8 years ago. Ted has a history of 4 drug abuse, which resulted in hepatitis C. He is taking his lithium exactly as scheduled, a fact that both Ted's wife and his blood tests confirm. To reduce Ted's mania, the psychiatric nurse practitioner recommends Option A. Clonazepam, Klonopin. Option B. Fluoxetine, Prozac. Option C. Electroconvulsive therapy, ECT. Option D. Luracidone, Latuda. The correct answer is option C. Electroconvulsive therapy, ECT. Electroconvulsive therapy (ECT) can be an effective treatment for reducing mania in patients with bipolar disorder who have not responded to medication. In Ted's case, where he has a history of bipolar I disorder. Question 16. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A. Teach the patient relaxation techniques. Option B. Gradual exposure to feared situations. Option C. Encourage the patient to attend social gatherings. Option D. Provide education about the disorder. The correct answer is option B. Gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home. Common. Question 17. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be Option A. Nursing Interventions Classification, NIC. Option B. Nursing Outcomes Classification, NOC. Option C. NAMDI Nursing Diagnoses. Option D. DSM-5. The correct answer is option D. DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 18. In pediatric mental health, there is a lack of sufficient numbers of community-based resources and providers, and there are long waiting lists for services. This has resulted in select one that doesn't apply. Option A. Children of color and poor economic conditions being underserved. Option B. Increased stress in the family unit. Option C. Markedly increased funding. Option D. Premature termination of services. The correct answer is option C. Markedly increased funding. The lack of resources in pediatric mental health leads to underserved populations, increased stress in the family unit, and premature termination of services. However, markedly increased funding does not align with. Question 19. Why is it important to establish a contract with a client with an eating disorder at the beginning of treatment? Option A. The client and healthcare provider form a partnership that is challenging for the family to disrupt. Option B. A collaborative approach to treatment planning ensures that both physical and emotional needs will be addressed. Option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Option D. Permission for refeeding is crucial as it can have adverse effects. The correct answer is option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Establishing a contract with a client with an eating disorder at the start of treatment is crucial to involve the client in decision-making processes. By engaging the client in decision-making, it enhances their. Question 20. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A. Monitor the patient's vital signs frequently. Option B. Keep the patient distracted with group-oriented activities. Option C. Provide the patient with frequent milkshakes and protein drinks. Option D. Reduce the volume on the television and dim bright lights in the environment. The correct answer is option B. Keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable. Providing nutrition, such as milkshakes and protein drinks. Question 21. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A. Sertraline. Option B. Lithium. Option C. Clozapine. Option D. Haloperidol. The correct answer is option B. Lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 22. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A. Selective serotonin reuptake inhibitors. Option B. Monoamine oxidase inhibitors. Option C. Serotonin and norepinephrine reuptake inhibitors. Option D. All of the above. The correct answer is option B. Monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 23. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 24. The mental health team is determining treatment options for a male patient experiencing psychotic symptoms. Which question shouldn't the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Option A. Is the patient expressing suicidal thoughts? Option B. Does the patient have intact judgment and insight into his situation? Option C. Does the patient have experiences with either community or inpatient mental health care facilities? Option D. Does the patient require a therapeutic environment to support the management of psychotic symptoms? The correct answer is option C. Does the patient have experiences with either community or inpatient mental health care facilities? Assessing suicidal thoughts, judgment, insight, and the need for a therapeutic environment are crucial factors in determining the appropriate treatment setting for a patient experiencing psychotic symptoms. Past. Question 25. A patient being treated for insomnia is prescribed Ramelteon, Rosarum. Which comorbid mental health condition would make this medication the hypnotic of choice for this particular patient? Option A. Obsessive-compulsive disorder. Option B. Generalized anxiety disorder. Option C. Persistent depressive disorder. Option D. Substance use disorder. The correct answer is option D. Substance use disorder. The correct answer is D. Substance use disorder. Ramelteon is preferred for patients with substance use disorder because it lacks abuse potential. This makes it a safer choice for individuals with a history of